T-shirt right there? Yes, sir. You could come up so that I can hear you, or you can, if you've got a very strong voice, yell from there. First of all, gentleman said that he's happy that the congressman is out here listening, which he is, and wants to know how he also said, unlike Waxman, the question is how the reform bill will pay for itself and remain self-sufficient, which is one of the stated goals of the reform. Congressman.
First of all, let me say I think my colleague Henry Waxman is doing a remarkable job on a very difficult subject. If this was easy, it would have been done a long time ago. And in answer to the gentleman's question, I would say this. First of all, how many of you think you can afford to hold on to the health insurance you have if it continues to go up 3 times faster than your wages? How many of you think you can continue to afford your health care? How many of you think that the country can afford to continue paying now 16% of GDP, then 20% of GDP, then 30% of GDP? How many of you think the country can afford that? How will a public option, how will we keep costs down in a public option? Because the more people that enroll in a government option, the larger the purchasing power of the government in terms of the acquisition of health services. When you have the bulk purchasing power of the government through a public option, you can bring down the price of prescription drugs, you can bring down the cost of providers as well. So it does allow a downward pressure on costs. And I would also add, because the gentleman, I think selectively quoted from the Congressional Budget Office, and what he didn't tell you is the CBO also says that a public option will force down costs in the private sector and result in tens of billions of dollars of savings. So, now, I will say, in fairness to the gentleman, and because at least the beginning of his remarks were very kind, I appreciate that, I will say that this is not an illusory concern, and it's going to take work to make sure that we keep the costs down to the public. But I think that, and this gets back to a point that Bruce made at the outset, the individual solution we're looking for America is one that I think preserves choice for all of us. To choose a public option or not choose a public option. To choose to stay with our current plan or not to choose to stay with our public plan. But for those millions who don't have health care, to choose to have health care, I think is essential.